Here we are in the pharmacy now, though, Randy, and some of your over-the-counter sleep aids may be linked to dementia and Alzheimer's. Dr. Joseph Ogile, the Clayton Sleep Clinic, and the executive board member of the National Sleep Foundation is here with the results of this sleep aid study. Good morning to you.
Good morning, John.
Happy New Year.
You too.
Okay, so this was done at the University of Washington in Seattle, and they indicated that some of these drugs, name them for us if you could, or what types they are.
Well, they're anticholinergics are commonly used. They're used for multiple things. The most common ones we see, right, are things like Benadryl and then antidepressants, old-time antidepressants called tricyclics that were used for depression, but sometimes now are used for sleep aids. There's also other anticholinergics we use. There's things like medicines for bladder control, because the anticholinergics, which control acetylcholine in our brain and other parts of our body, can help us with other functions in our bodies, so to speak. Those drugs were found over a 7-year period in 3,500 people to increase the risk for dementia. What are the ones that we use? The most common one that you and I would talk about for sleep would be either Benadryl over the counter.
That has antihistamines in it.
It does indeed.
So that's a part of this too.
That's a part of it as well. And then the other ones are the tricyclic antidepressants, which commonly are given. And there's things called like imipramine, dazipramine. That's how people can look at those.
Well, this study included more than 3,400 men and women aged 65 and over. They were noticing more noticeable effects on older people.
Yes.
But this isn't for sure. This is possibly. I mean, what's your advice, doctor?
Well, the association appears significant. So what we would caution people to not stop any medications without talking to their physicians. The National Heart, Lung, and Blood Institute in Washington said it's very interesting data, a good study, that before we know what recommendations to make long term, we should have more data to look at. But we should start already being cautious about using this class of drug in older folks when we don't think we need to, or there's other alternatives. And there are other alternatives.
One alternative, and I'll take this from time to time because of our crazy schedule, it's a natural herb called melatonin.
Yes.
And that has no side effects.
No, it should not in this particular situation. Melatonin's a good agent. It's a naturally occurring hormone that you can buy without a prescription. It is one of the hormones that help us go to sleep at night normally. In your particular case, yours and Randy's, which is very interesting, is people who need to go to bed earlier than normal. Melatonin is a good choice because it helps you ease into sleep a little bit earlier because your body's not ready to secrete the hormone at that time. Even the other prescription alternatives that are out there, and we have some good choices today, are probably more safe in the long run than the anticholinergics and antihistamines used inappropriately. And we do, by the way, see clinically people who come in, John, elderly patients brought in by their families who will start having mental breakdown from using too much antihistamines.
Dr. Ogile, thank you so much for coming in.
Good to see you. Yes.
All right. And we're going to take a little break right now. Don't fall asleep just yet. We've got more Fox 2 News in the morning after this.